year is a great time for moms to look and feel great. And in this week's Women's Care Wednesday, Dr. Effie Politis from Women's Care Florida discusses mommy makeovers. I love this. Good morning.
Yes, good morning. Thanks for having me.
So let's chat about this. This has changed over the years, as we were just discussing right before we got started. But explain what a mommy makeover is.
Okay, that's a great question. As you know, after we have children and breastfeed, and as we age in general, our bodies change. And a lot of these moms and grandmoms are interested in total body rejuvenation, which is done very safely in an outpatient setting these days. What it means is some breast and abdominal work that is paired together.
I was just going to ask that. So it is done together. The procedure's done together, kind of in and out.
Yes. So you can pick two body parts. Now, I've had some patients that want to focus on their arms and their breast.
Okay.
But typically it's breast and belly, whether that involve a breast reduction or just a lift or an implants with a lift, depending on, you know, their physical examination, clinical exam. The abdomen's a great addition because, as you know, we get loose skin. A lot of our women have had C-sections, multiple C-sections. So we are able to tighten up the abdominal muscles, get rid of that excess lax skin, and it always is paired with some sort of liposuction in those hard to lose areas.
Well, and my first question was, do you need to know that you are done having kids? I mean, who is the ideal candidate, you know, for this procedure?
Yes, as you know, I'm a board certified plastic surgery, and our society and I in general do like to have the patients make sure they're done having kids overall. There have been some studies showing some intrauterine fetal compromise. However, it's hard to know, but yes, it would be ideal for you to be done having children, and you'd want to wait 9 to 12 months after your last child, so your body weight is at its ideal weight.
Okay, and then do you encourage patients to also exercise and get their body ready for this as well?
Yeah.
I mean, is it?
I certainly do. In fact, we have a nutritionist that I can work with because it's hard for some patients to get back to that ideal weight after having all these kids. They don't have as much time to focus on themselves. Our nutritionist has been great, but yes, there is an ideal BMI for this. That's calculated by me. I talk to this with the patients. I also like them to exercise and work out, and sometimes we share exercise plans with them because those patients get the best result.
Okay, all right. Let's talk about the surgery center that this is done at as well, because this is, I know you guys are very proud of this, kind of somewhat unique as well, but explain why someone can really feel good about going to where you guys are going to get this done.
So our surgery center is JACO and Quad HC accredited. This is to the highest standards.
You say it's like going to a hospital, even though it's not.
It is like going to a hospital. All of our staff is extremely well-versed with this type of surgery, so all the GYN breast and plastics cases. I feel very safe and confident there as a board-certified surgeon. The patients have had fantastic experiences. It's very private. It's women only, and we have state-of-the-art equipment in terms of, we have a board-certified anesthesiologist that is administering anesthesia. All our nurses are accredited, and we have state-of-the-art equipment in terms of liposuction, fat grafting, which is very popular and often paired with the mommy makeover.
Yeah.
So
we have a little less than a minute left, but talk about recovery, because I know you and your team want to be very realistic about this as well. What is recovery time? What do you suggest patients kind of have on hand and ready?
Yeah, another good question that I always discuss with my patients. So let me just start off by saying that we are, the patients are recovering faster because we have enhanced recovery protocols for them, including our infusion center, so they're not taking narcotics or opioids anymore. But I do tell my patients they should have a support network for the first 2 to 3 weeks in place, whether that be their spouse, a friend, or a family member. You can expect significant downtime for 2 to 3 weeks, but then after that you will be able to drive, move your kids around. I don't like them picking up their toddlers or anything for approximately 4 to 6 weeks. So we just we have a realistic conversation, and then we schedule this around a time that's great for them. But it's such a great procedure to make moms and grandmoms feel better about their body image.
I just love this, and I love that there's a nutritionist on staff, and the surgery center, and the
we have an infusion
doctor.
center.
I mean, it's the whole thing.
Yeah.
So thank you so much. We appreciate your time this morning. We're going to put the info up if somebody wants to go ahead and schedule that first consultation to see if they'd be a good candidate. That's where they can do that. Certainly check them out online as well. Doctor, thank you so much. We appreciate your time.